can become very severe. Likewise, children who are pregnant women, when they do become pregnant, their immune system changes and they become susceptible to the disease. So those are what we call the vulnerable groups in our environment. And what we are doing right now in the States is that we give children under 5 and pregnant women who present at our health facilities long-lasting insecticidal nets for free. Any woman who is pregnant that presents to the state health facility, the public health facilities, for the first time would get a free net. Likewise, children who have completed their immunization schedule would also get a free net, and they're expected to sleep inside the nets.
I will come back to the issue of the nets because a lot has been said about it, but let's talk more about malaria in pregnancy. If a woman is pregnant and is not taking this preventive medicines, what are those things that can come up?
Now, first of all, when a woman is pregnant, at the time she's pregnant, she should present to the health facility. By the time she's 20 weeks, she starts to take what we call intermittent preventive treatments, which is usually sulfadoxine pyrimethamine, to prevent her from getting malaria in pregnancy. She's carrying a life. She's also a life. So the two combination with malaria can be very deadly. So it's important that she takes those drugs appropriately. Then, when a woman is pregnant and she's not properly managed when she does have malaria, it can be very devastating, like I mentioned. It can lead to death. She cannot have severe malaria. Anything can really happen during that time. So it's important she just not only takes the intermittent preventive treatment, she also sleeps inside the nets.
And it's important.
Yes.
Okay, now let's talk about the nets. Some people have complained, oh, the net is, when you sleep under it, the heat is too much, and and they don't tend to want to use it because of that. What is it that has been done to ensure that these nets don't get to give too much heat that will make people not to want to use it?
It's important that when one gets the nets, they aerate them underneath a shade so that the chemicals with them are they don't in any way affect them afterwards.
Okay, you mean when you get the net, whether you buy it or you are given free from the hospital, you air
the net underneath shade, not in the sun. So you make sure that it is
why not in the sun and underneath shade?
Because it would affect the chemicals, the insecticide on the net if it's underneath, if it's directly underneath the sun. So when it's under the shade, they eventually start to react to, the chemicals are properly embedded within the nets, such that when the mosquitoes do come near them, and they collect a bit of the chemical, when they perch on the net, they collect a bit of chemical and then go off to die. So if that isn't properly done, the person may start to react. People have complained about the heat, but then if you consider the fact that malaria can actually lead to death if it's not properly managed, and one can be prevented from getting the disease, the benefit of the nets is a lot more than the heat that the person is complaining of. Okay,
so you want to weigh the two.
Yes,
Do you want to get malaria just because of the heat, or you want to protect yourself? Now let's talk about the treatment the more. The first line treatment medication is the artemisinin-based combination therapy. But some people, and just on this World Malaria Day, the minister was saying that they should stop prescribing chloroquine. Some people still use chloroquine. Why was it stopped, and why is it important to use the ACTs?
We talked about resistance a few minutes ago. The reason being that artemisinin combination therapy have been discovered to work very well in treatment of malaria is because it works properly. It works adequately. Chloroquine no longer works for malaria. A lot of people have abused it in the past, so there's a lot of resistance to chloroquine in the treatment of malaria. ACTs, artemisinin-based combination therapy, are what are used now. And when they are used appropriately, in the right quantity, at the right time, in the right doses, it works very well.
So tell us about the importance of finishing the dose, because for some of us, okay, I've taken the first and the second, I feel better, why should I finish it?
You have to finish it, because resistance can develop if you don't. And nobody wants to start looking for another drug that would work in treating malaria, because it's expensive. ACTs were initially expensive, but now they're a lot cheaper than when they first came into the market. So if one doesn't do what is appropriate, definitely you're causing a lot of problems within the environment and the world at large.
And then even the person, if you don't finish the treatment, the parasites can come with, a full force.
A full force, causing part of the reason why there's resistance in the first place. So, a situation where a person doesn't finish his medication, you have a bit of more, even though some of them may have died, some of them are still there. And then you don't finish it, the parasites start to change, start to morph into something, and start to change shape, and resistance can start to occur.
And some people will tell you, this orthodox medication don't work for me, so I go for herbs. What is the danger in this?
The herbs that we're talking about, we don't know what the quantity of herbs that a person takes. Besides malaria that you're trying to prevent, you end up having a lot of other damages within your system. The liver can be damaged, the kidneys can be damaged. So it's important that you take the drugs that have been recommended rather than taking herbs that have not been quantified. You don't know what is in them. You don't know what they can do to you. And at the end of the day, you do more harm to yourself than good.
And we don't want that.
We don't want
so
that.
We should go with the recommended treatment, line of treatment.
Yes.
Now, if we don't finish this medication, you've talked about some of the complications that can arise, or if malaria is left untreated in the first place, what are the likely complications?
When malaria is left untreated, it can result in what we call severe malaria. Severe malaria is such that the person comes in unconscious and then can begin to develop organ damage and eventually death. And when that happens, particularly when it's very severe, there's little or nothing one can do. However, when the severe malaria do arrive at the hospitals, we have to treat them with what we call injection artesunate. And that is a lot more complicated, so to speak, than having to treat with ACTs.
So it's better to treat as soon as
possible.
Malaria is diagnosed.
Yes.
Okay, we'll take a quick break, and when Health Matters returns, we'll be talking more about preventing malaria. Do stay with us on the show.